Good afternoon, everyone. Welcome to DCYF's Legislative and Budget Mid-Session webinar. This session is being recorded. I want to welcome everyone here today. We do provide this session, although it says mid-session, we're actually nearly at the end of the session. We have just a week left before the legislature adjourns on March 12th. And the main presenters will be Julie Watts, Deputy Director of Government Affairs, and Brianne Boggs, Deputy Chief Financial Officer. My name is Barbara Serrano, Chief Public Affairs Officer. So next slide. All right, I'm going to turn it over to Marlene.
Hi, everyone. Welcome. Everybody will need to select an interpretation channel because this webinar is being provided in English and in Spanish. So everybody go down to the Zoom bar, or you'll see the interpretation globe, and click on your preferred language. Okay, so now I'm going to say it in Spanish. Bienvenidos todos. Este seminario va a ser dado en español también. Y si estás juntándote aquí en español, tenemos intérpretes, pero te tienes que meter a un canal de español. Entonces lo que vas a hacer es, a mero abajo vas a ver un círculo que dice More. Haz clic al círculo, vas a ver un globo que dice interpretación y vas a hacer clic en español para que puedas escuchar a los intérpretes en español. All right, and I think we're good.
Great, thank you. Just briefly going to summarize the agenda. We'll be providing an overview of where we are in the session with respect to bills that have been introduced since the beginning of session in January, bills that are alive, bills that are dead. We will also talk about the proposed budgets from the House and the Senate. Both chambers have actually passed those budgets obviously with revisions. Ultimately, their goal is they've actually entered conference already, I believe, and will come out with a proposal that they will then pass ideally by March 12th, send to the governor. The governor will have 20 days after the end of session to sign that bill. And then we are providing time at the end for your questions. And please do feel free to pose questions in the chat. We are monitoring those as we go along. Next slide. All right, this is just a session timeline. Beginning of session was January 12th. This includes the various cutoff deadlines. Again, March 12th, next Thursday is sine die. Let's go to the next slide. I'm going to turn it over to Julie at this point. Thank you.
Thank you so much. Thanks, Barb. I am going to talk a little bit today about some of the bills that we've seen this legislative session that would have had some of the greatest impacts on the department. So just for awareness, when a bill does not move through the legislative process along a particular timeline, and it doesn't get voted out of committee or get voted off the floor within certain deadlines that we call cutoff dates, the bill effectively dies. We often refer to those as dead bills, and I just want to highlight some of the legislation that has been introduced this session but hasn't made it through the process. So as many of you know, we introduced agency request legislation to update our licensing statutes. So most of these, the changes in this bill were technical in nature. The bill did pass the floor of the House, but it did not make it off the floor of the Senate. So we will need, DCYF will need to look to the 2027 legislative session to get that bill passed. So we won't be seeing that happen this session. DCYF has also been carefully tracking and weighing in on legislation to address our problems with overcrowding in our juvenile rehabilitation institutions. You likely know that overcrowding is particularly bad at Green Hill. And House Bill 2389 had several provisions to it, and I won't go into all of them. However, it would have given the department the ability to address overcrowding in secure facilities in some emergency situations by transferring some youth who would meet certain criteria to the Department of Corrections. It would also have removed barriers for youth to be able to go into community placement when they have demonstrated that they're likely to be successful in a community placement. So unfortunately, the bill did not move off the floor of the House this session. So we will also need to look to next year to seek a solution to overcrowding. We were also very involved in some bills that sought to address the increase in child fatalities and near fatalities among families involved in the child welfare system. House Bill 2660 and 6308 would have allowed courts to order certain conditions when DCYF files a dependency petition and we go to a shelter care hearing. Senate Bill 6319 would have created a process for referrals for child welfare families to community-based services in certain situations. Unfortunately, none of those bills made it out of their house of origin, so those bills have died as well. Finally, we were also closely tracking 6239. This bill was seeking to address high legal payouts from the state in some tort claims and some lawsuits and tort claims. The state has seen over the last several years a pretty dramatic increase in tort payouts linked to lawsuits against the state. So this bill was a first attempt to try and rein in some of those costs. Unfortunately, that bill died as well. We expect to see a provision in the final conference budget that will direct the Office of Administrative Hearings to conduct a work group that would make recommendations to the legislature by November. So this is a policy idea that we expect to see come up again next legislative session. So we're going to move on to the next slide, and I will turn it over to Deputy Chief Financial Officer, Brianne Boggs, who's going to talk about some of the investments and child welfare in the budgets.
Thanks, Julie.
Brianne,
Just quickly.
sorry, we're getting a message from the interpreters to please slow down when you speak. Thank you so much.
Hi, everyone. So just to orient you to this slide, what we're comparing for a fiscal comparison is the Senate proposal and the House proposal, both of which are currently in conference and will ultimately become the final budget proposal in the next few days, most likely. So to start, caseworker caseload ratios. This first item provides funding and staffing at the same level as the governor's proposal for the child welfare workload model. This was based on estimated need from the new child welfare workload model. The slight difference in funding that you see was a technical error. So if this item is funded in the final budget, it would likely be at the lower level, but this is just technical. This was also an agency request. The next item, Regional Disability Liaison Program. This was also an agency request and was also funded in the governor's proposal and provides staffing and settlement payouts to meet legal requirements tied to a voluntary resolution agreement. This is to avoid further civil rights enforcement actions from the federal government. The next item, Intensive Foster Care Assessment Program. The House proposal included $400,000 annually for this new program that would assess the needs of children who had been in the foster care program for more than 90 days. The Senate did not include this funding, so this would be part of the negotiations in the conference process to see where we end up. The DS settlement, there was an overall reduction to the DS settlement funding. This is based on an underspend in the emergent facility-based receiving care services in fiscal year 26. Some of this underspend was transferred to another part of this program, which is the Emerging Adulthood Housing Program. And both budgets provided funding that was requested by the agency and also provided in the governor's proposal to do stakeholder work tied to the DS settlement. Finally, on this slide, the King County commercially sexually exploited children funding would be for a pilot for a new receiving center in King County. This was one-time funding provided in fiscal year 27 in the Senate budget only. Next slide, please. So the critical incidents response budget proposals, DCYF did an agency request tied to the increase in critical incidents, and the governor's proposal also provided funding for this decision package. You'll see that the Senate and the House take a different funding approach to these specific components that were part of our decision package. Both proposals expanded funding, or sorry, I said that wrong, funded the expansion of the Plan of Safe Care program to 5 high needs communities. This would provide care coordination and resource navigation to expectant mothers and newborns with prenatal exposure. The Senate proposal also included funding to expand the number of slots in the Parent-Child Assistance Program. This program would provide home visitation, and case management for pregnant and parenting mothers with substance use disorders. The Senate proposal also provided funding to purchase and implement an updated child welfare safety framework tool in 2 communities. And the Senate proposal included funding for a new family resource center referral program for 5 high needs communities. The last item, public health support or public health nurse support. This was funded in both budgets. However, the Senate provided the funding directly in DCYF's budget, and the House funded this in a way that it would flow from OFM directly to local health jurisdictions. So same funding amount, but a different way to provide those funds. For the next slide, I'm handing it back to Julie Watts, and we'll talk about some of the early learning bills. And Julie, just to pause, I'm wondering, should we take questions as we go, or we'll respond later? I just see a lot of questions over in the chat.
Why don't we pause and see if we can work through some of the questions that are in the chat, or in the Q&A, I should say. I'm seeing one question. House Bill 2511 was also a good bill that would have defined imminent physical harm and reduced the critical threats. Will this be brought up again next session? So I would just say yes, that bill was introduced this legislative session. It would have defined imminent physical harm. The bill did not move out of committee this session, and I do expect that there will be conversations during the interim period about that proposal and many other approaches that could be taken to address the increase in critical incidents. So we will have to wait and see as to exactly what comes forward next session. There's a question about why there are no Somali interpreters available, and that there are many Somali childcare providers who were encouraged to join because this impacts them. So I'm not familiar exactly with the process to request interpretation for the webinar, but I'm not sure if Jessica, if you're able to speak to that.
Sure. We received requests for Spanish interpreters for this webinar, but did not receive any requests for Somali, but definitely can for future webinars by request.
Okay, great, thank you. So just wanted to, I'll move on, talk a little bit more about the early learning bills, and we can kind of continue to take questions as we go along. As I mentioned before, many of the bills that we've been tracking this legislative session died either in committee or on the floor. However, we do have several bills in the early learning space that are still active, passing both floors of the legislature or likely to pass. So I just want to go over some of those bills. House Bill 2219 allows for flexibility for mixed age groups in centers and childcare centers, and it directs DCYF to waive certain pre-service orientation requirements for some individuals. So this bill had no cost, and so there was no funding for it in either budget, but it has passed and is on its way to the governor's office. House Bill 1128 is a bill that establishes the Washington State Child Care Workforce Standards Board to develop recommendations on some of the minimum employment standards for child care workers. So the Standards Board would be housed at the Department of Labor and Industries. This bill passed the floor of the Senate yesterday and is going to the governor's office for signature. And the House appropriated a small amount of funding to DCYF to participate in the board. Senate Bill 5968. So this is request legislation from the governor's office, and it aligns with some an existing executive order that the department is already implementing with regard to timelines for issuing licenses. That bill is no cost to the department, and so no money was appropriated in either budget. Next slide, please. So there are several other bills that will have a big impact on Working Connections childcare and the Early Childhood Education and Assistance Program. Senate Bill 5872 is a bill that establishes what's known as the Pre-K Promise Account. And that would be used for the early learning, the Early Childhood Education and Assistance Program, otherwise known as ECAP. This bill will allow the state to leverage charitable dollars and to maintain and expand ECAP slots so that we can continue as a state to provide high quality early learning for 3- and 4-year-olds in Washington. That bill has just passed the floor of the House and is also now headed to the governor. House Bill 2317 is also connected to this expansion, and it's really aimed at making it easier for some providers to fill ECAP slots. It would exempt school day ECAP and Head Start programs located in public school buildings or community or technical college campuses from needing to meet DCYF's childcare licensing requirements. And Senate Bill 5500 relates to DCYF's biannual market rate survey. So this bill requires that the survey that we currently publish also include a cost of quality childcare study and a cost of quality report. So there are two other bills that are related to Working Connections childcare that are taken up in both the House and the Senate budgets. And I'm going to turn it back over to Brianne to talk through how the House and the Senate budgets take different approaches to creating an attendance-based system for paying childcare providers and Working Connections.
Thanks, Julie. So what you see on this slide are the Senate budget proposal that links to the Senate Bill 6353 and the House budget proposal, which ties to House Bill 2689. The estimates on this page are what were included in the budget proposals, and these will differ from what you would see in the published fiscal note, which is the agency's estimate of the impacts of these bills, just to provide some clarity. So the Senate proposal, and let me start again. So both of these proposals take an approach of changing how providers are paid versus doing anything like a cap to the Working Connections program or changing eligibility. So the first proposal for the Senate modifies the attendance-based provider reimbursement. So providers could be reimbursed up to 15 days if a child attends between 1 to 15 days in a calendar month. And this would start in October of 2026 for childcare centers. And this policy would start July 1 of 2027 for licensed family home providers. I'm going to talk about the House proposal next, just to compare these two proposals. So the House bill also changes how providers are paid based on looking at a child's attendance to childcare. So the House proposal would adjust the monthly payment policy to align with the child's attendance beginning October of 2026 for a childcare center and July of 2027 for all other providers. If a child has 10 or fewer absences in the month, the provider would be paid for the full month. If a child has 11 or more absences, the provider would be paid for half a month under the House proposal. This is an area of large difference. So this is getting worked out through the conference process, and we will likely see a different bill with different language, either aligning with the Senate or the House or some variation on these two policies. And to be clear, currently, there is an attendance system and providers provide that information, but providers are not paid based on the attendance system. So this is a very significant change in how providers will be paid going forward. The next item, enrollment-based pay. This is a policy that has not been implemented yet. So it shows up as a $45 million reduction. However, in the budget, in a different part of the budget, maintenance level, you would see a positive 45. So essentially what they're saying is we're fully funding this policy at maintenance level, and then at the policy level part of the budget, this funding is removed. So this is, while it looks like a large reduction, it is simply removing funding for a policy that has not yet been implemented yet in fiscal year 27. The next item, enhanced regional rates, is a reduction tied to eliminating certain enhanced regional rates for 4 childcare regions. So essentially aligning those rates in a way where there is a savings. IT support, information technology support, the House proposal in the budget provided $1.5 million to help align our Working Connections IT systems with the proposed changes. Next slide, please. So early learning program spending. These are other changes in the budget for our early learning programs. The first item you see, home visiting underspend. This is a one-time reduction based on underspending in fiscal year 26 due to delays in a rate increase implementation. So this is not a cut to the program. It is simply there was an underspend and they are removing this funding level in fiscal year 26. The next item, professional development. This is a reduction to professional development activities. in our child care program that would include contracted supports and training for providers, and reduces the funding by approximately 50% in the House proposal. Next.
Before we get into the JR part of the budget, I do see some questions that I thought maybe we could take up pertaining to early learning. One of the questions, though, is where can I find this recording after the Zoom meeting is over? Within a day or two, we will publish this recording and the slides from this webinar on the Government Affairs page on DCYF's website. So that's where you can find it. Another question is the rate increase of tuition rates going to be implemented from July 2026? And I think, Brianne, that might refer to the center-based rates. I think that might be what the question is. I don't know how the two budgets treated the center-based rates.
And I might need to get back to this question. What I need to confirm is that the House and the Senate budgets took the same approach. But there is an impact to future rates in both proposals. What I would like to do is type an answer because I can be more clear in my response. So, Julie, I might type that answer during one of your slides.
Okay.
To answer that question, but I can provide a fairly clear answer based on our fiscal note to help respond to that question. And I think it would depend if we're talking about childcare centers, because that is the specific area where the legislature can change what that policy is. Other rates are subject to collective bargaining.
Another question, Senate Bill 5617 would have revised the CHINS or Child in Need of Services statutes in ways that would have resulted in more teens entering foster care. What happened with this one? It's not clear from my quick look at the legislature website. That bill was moving through the process last legislative session, and the legislature did not take any action on Senate Bill 5617 this session. So that bill is effectively dead at this moment. Jennifer is asking, the proposed working connections, childcare reductions, is this supposed to close centers? Is that the goal? And no, that is not the goal of the reductions. The reductions are really coming from a place of the state facing a pretty significant budget shortfall and just looking to achieve savings going forward. Another question, there is a proposed 50% cut in the professional development funding. Do you have an update or details what will be cut if it passes with the reduction? Are you familiar with what?
We don't have those details on what would be cut if that proposal is in the final version of the budget, then we would have more information on how that cut would be taken or implemented, but I don't have that information as of now.
I'm going to suggest that we move forward with the JR part and see if we can pick up some of the other questions because there are quite a few of them now. As we get toward the webinar, I want to make sure that we're getting through all of our slides.
Okay, so moving on to juvenile rehabilitation. So what you're seeing here is in the first item, the House proposal included $2 million to increase the juvenile court block grant program that provides grant funding to county juvenile courts for the purpose of serving youth who are referred, diverted, or adjudicated as a juvenile offender. That funding level was not included in the Senate proposal, so it is an area where we'll see change or alignment potentially one way or the other in the conference proposal. The next item is additional funding, additional staffing for the Community Transition Services Program. The staffing level would help expand the program from the current average daily capacity of 20 young people to 48 people in the House proposal and to 40 people in the Senate. So just slight difference in funding level, but both are expanding that program, which should hopefully help capacity for young people who are eligible to leave Green Hill School and enter this program. The final item is the House included $250,000 in fiscal year 27 for future operating costs to open a secure facility that houses 30 incarcerated individuals. There was no funding in the Senate proposal for this item, so it is an item that will be discussed in the conference process. Next slide, please. So the first item you see here, county detention bed rate. This was part of an agency decision package that was carried in the governor's proposal, and ultimately you see funding here in both proposals. The rate was increased from $150 per day to $250 per day for our contracted county beds. We do anticipate a lower funding amount in the final budget that's based on a technical correction, not tied to the dollars per day changing, but just tied to the number of days we counted in our estimate. So this may appear as a lower number if ultimately it's funded in the final proposal. JR facility maintenance costs. This is one-time funding that would help provide for new equipment and goods and services for facility maintenance to help maintain our secure facilities for projects that are not a capital project in nature, but are considered ordinary maintenance. And finally, Harbor Heights is one of our current facilities. There is funding that was included. You don't see it in the actual budget because it exists in fiscal year 28 and 29 as a signal to continue the funding level for this 48-bed living unit facility that's on the campus of the Stafford Creek Corrections Center. The House budget did not include that in their outlook, so this is an area where they'll have to come to an agreement. Next slide, please. So this is focused on funding levels at Echo Glen, the Echo Glen facility. So there was one-time funding provided for temporary security staffing in fiscal year 26 while we complete a new security fence. And there is an item in both budgets to increase the number of juvenile rehabilitation officers at our Echo Glen Children's Center effective May of 2026 at slightly different staffing levels. Next slide, please. This is now about the funding for our secure facility, Green Hill School. Similar to Echo Glen, there is one-time funding to fund security services at Green Hill School through February of 2026 in both budgets. And there is funding for juvenile rehabilitation officers at Green Hill School to enhance staffing in our graveyard shift starting May of 2026 at slightly different staffing levels. Next slide, please. So this shows some of the reductions to the juvenile rehabilitation program. The first one is for the Senate proposal only, and it removes opioid funding that was provided for a nurse and a physician to provide medications for opioid use disorder, counseling, case management, and education to youth in our facilities who have opioid use disorder. This funding was eliminated in the Senate proposal, but not the House proposal. And this final item is just showing that in what we call maintenance level, which is a part of the budget that is usually considered mandatory due to caseload changes, there is a reduction due to our caseload level decreasing that results in a reduction of staffing. So the overall picture for juvenile rehabilitation is that this reduction results in a negative number of staffing for fiscal year 26 and 27, despite the additions that were provided on the previous slides. This is about our capital investments for juvenile rehabilitation. You can see there are some slight differences on these items. So the first one is continued investment to add additional capacity, and this would fund design work for a medium secure facility that would serve 50 or fewer youth and would open in 2029. The House provided funding to continue this work, and the Senate did not provide funding in the capital budget. So we will see what the final proposal brings, since there's a difference here. The next item is Green Hill School HVAC upgrades. This funding level was provided in the House, not in the Senate. So it's an area of difference where we'll see the final proposal. There's alignment in the funding for providing Green Hill School's sleeping room doors and locks upgraded, $1.8 million in both capital budgets. Also alignment in Echo Glen secure facility improvements. And then finally, minor works projects are a list of small projects that occur, and we received more funding in the Senate proposal than in the House. So we'll anticipate a different number here in the final conference capital budget once the two sides come to agreement. Next slide, I'm handing it back to Julie.
Okay. Thank you, Brianne. So I just wanted to kind of go over one of the bills that just passed the floor, actually, and so now is headed to the governor's office just within the last hour. Senate Bill 5911. This bill basically currently DCYF will reimburse itself for the cost of providing care to youth to children in foster care who receive Social Security benefits. This bill will prevent the department from being able to do that when youth are placed into extended foster care. If youth are in extended foster care, we would not be able to use the dollars to reimburse for the cost of care, but it would instead assist youth with applying for benefits and place those benefits into achieving better life experience or ABLE account, which is an allowable account for the Social Security Administration to be able to save those dollars for the future use of the youth. And that bill was funded in the Senate budget with about $613,000, and it was not funded in the House budget, but it has now passed the floor, and so we do expect to see that funding in a final conference budget. Next slide.
So this is funding in our program support part of our budget for an agency request that was also included in the governor's proposal and is ultimately funded in both the House and the Senate proposals. So we would anticipate likely seeing this in the final conference budget. So what this is for is funding for 2 FTE staff and to increase funds for contracted qualified expert witnesses. And this is to make sure we have ongoing compliance with providing qualified expert witness testimony due to the increased number of child welfare cases that qualify for this under federal and state Indian Child Welfare Acts. What this does is a qualified expert witness is available to testify in a custody proceeding to provide culturally relevant perspective during those proceedings. Next, please. So administrative reductions. Both the House and the Senate proposals included administrative reductions to all agencies. That was also true in the governor's budget proposal as well. The scale of these reductions differs between the House and the Senate. It is highly likely there will be an administrative reduction in the final budget proposal, although we do not know the level to which that will be. So the Senate proposal essentially was cutting certain administrative costs by 1.5%, and the House proposal also selected other types of administrative costs that it reduced by 3% across our entire agency. And the reductions are being carefully considered by our agency to try to reduce impacts to staffing and direct services. Next slide, please. And Julie, I think I'm handing this one back to you.
Yeah. So we just wanted to highlight a couple of other agencies receiving funding that relate, and particularly with these investments that relate to the early learning space. So the House appropriated $16.3 million for early learning facilities development for a minor renovations grant. So just aware of that as a part of the capital budget. And also the transition to kindergarten program, both budgets do take a reduction to what's known as TK, or transition to kindergarten. This is funded through the Office of the Superintendent of Public Instruction. So just some awareness of those cuts there. And I believe that is our last slide, and that we can maybe return to our Q&A and respond to some of the questions that we're seeing here. So one of the questions asks, and we covered before, I think, enhanced regional rates in early learning. Can you explain more about what these are and why the funding is being cut?
So what I'd like to do is write a response into the chat, because this is fairly technical. And I will say our fiscal notes are public now on both of those bills, 6353, and I'm forgetting the other bill number at the moment. Hold on, it's right here. Sorry, 1 second. I think it's 2839. Is it? 1 second. Just scroll back at my presentation. Sorry, 2689. So those two bills have fiscal notes that are published that should be helpful in explaining some of our assumptions around the estimates tied to these things. So what I'll do is I'm going to put a response directly in the chat to try to help explain that. And I also have a response for the person who asked about, I believe, center rates. So I'll write those in.
Okay. And I can take the next question, which is, how is attendance tracked if our licensed site uses a different attendance program? So if you're using a different electronic attendance program than the departments. And so what I just want to be clear about is both the House and the Senate budgets, this would not change how we currently how providers currently bill us. So you would continue to attest to your attendance. We wouldn't necessarily be checking your billing of the department for services provided against the attendance system, except when we're auditing our billing. So you will continue to attest to just the number of days and the service units provided in your billing. So that would not change under the House or the Senate proposal. Let's see. So for the Senate attendance policy, it was my understanding that payment would be made for 15 days and then per day an attendance after that. Was there an amendment to change that is just being paid up to 15 days of attendance? And no, the Senate proposal continues to pay up for 15 days and then for by the day after, for every day above 15 days. See, are they reducing the current daily rates for all providers, or is it for centers or home providers? The attendance policy in both budgets would apply to both both the House and the Senate proposals would apply to both center providers and to family home providers. See, on the daily attendance policy, lots of questions about the, I think we're going to have to do another webinar after the conference budget just to focus on early learning. So on the daily attendance, what happens if a child attends more than 15 days in the Senate bill? So then they would bill for each additional day above 15 days. And that's the Senate approach. Do they plan to cut early achievers funding to the centers and requirements to save money? I am unaware of any cuts to early achievers funding, so those grants will continue. There was another bill this session that would just kind of like swap the funding source for the early achievers funding, but that funding has not been cut in either House or Senate budget. When will the fence at Echo Glen be completed? Do you know, Brianne? We might have to follow up with that one. Okay, sorry, folks, we don't have all the answers today, so just to be clear. So another question, Working Connections Childcare, there had been a proposal to cap enrollment at certain number of families starting in July 2026. Do we know the decision on that item? So that was a proposal that was in the governor's budget, and there was a bill associated with that that would have put into place a soft cap to the Working Connections Childcare Program. Neither the Senate nor the House took that approach. So that's not currently something that they're continuing to consider. They are instead looking at how they can achieve savings through the attendance-based policies that are in the House and the Senate. I was hoping to get an update on the potential or proposed cuts to ESIT. Can you provide any information on where that stands? We did not see any cuts to ESIT in either the House or the Senate budget. We do know that that members of the legislature are wanting to look more closely at the ESIT program, but they did not propose any changes to ESIT this legislative session. Let's see, can we get a link to the bills where the notes are posted? I can work on trying to put some links to some of the to some of these bills, and we might be able to put links into the bills that we covered onto the department's website. And when we load the webinar and the slides, let's see. Can you please elaborate more on 2219? So 2219, so this was a bill pertaining to early learning. The goal of the bill is to try and make it easier for childcare centers to operate and kind of reduce, create some efficiencies. So what it does is it allows for mixed age groups. So for centers to have mixed age groups at different ratios than they currently have. It also allows, there's a pre-service orientation that allows the department to waive when someone has previously taken that training and there haven't been updates to the training. So I hope that provides a bit more information. See. One question about, I believe this is about the network administrator. And so there's a question in the chat. If FIN or the Family Impact Network does not get funded, they're cutting, I guess I suggest cutting services array consultants in region 1 and 2. I just want to be clear that the network administrator was not cut in either the House or the Senate budget. That was a proposed cut in the governor's budget, but we're not seeing that cut show up in the House or the Senate budget. Another question, oh my gosh, we have so many questions. We will keep going through them though. Just to clarify, nothing passed that would modify the Keeping Families Together Act. Yes, that is true. There were no bills that made it through the process that changed the removal standards or any other component of the Keeping Families Together Act. Let's see. I think providers are very worried about the attendance policy change and the subsidy. Yes, I hear that. I've been hearing that a lot this legislative session from providers, and clearly this is a big change, but that's being proposed in both House and Senate budgets. Question is, in our area, what will DCYF do when all 4 of its licensed providers in our rural area closes due to this change? We hope to try and work with providers to help them be able to bill according to the new policy. We do want to help providers to be able to operate their business. So I just want to, be clear that the department, is wants to do what we can to support providers to be able to provide the services that they provide to our communities. Let's see. Will they cut 2,100? And I'm not sure what that refers to. So I'm not sure how to answer that question. For House Bill 1128, minimum standards for childcare, does this apply to child welfare or JR? No, these are minimum standards for childcare providers and don't relate to staffing in DCYF, child welfare, or JR. And Barb has her hand up, so I wanted to pop in.
Thanks. I just saw there's a question from Maria Carriedo. She's asking if Bill 2219 states that children can be mixed.
Yes. It allows for mixing ratios.
Thank you.
Mixed age group ratios.
I'm working on the response to the center rates. I want to be careful here because it's complicated, and I have a question in my mind. We do have a published fiscal note, but I'm working on the answer. I just wanted to say that I was going to type it in when I have some clarity. My team's helping me.
Okay. We have another question about House Bill 2688 and the reimbursement rate for ESID. And I believe that I'll just say that neither the House nor the Senate budget impacted ESID. There was a bill 2688 that proposed delinking that from the multiplier, but delinking ESID from the special education multiplier. They did not move forward with that proposal, which would have, resulted in some changes to ESID. So let's see. So there are some technical questions I'm not sure I'm going to be able to answer, but I will read. So if we have a child that is set to come up for 20 days a month, February had 20 days, but only attends 9, we would only get paid for half the month, even though we saved his sport for the entire month. I'm going to have to just turn to some, we were going to need to, in terms of some of these technical questions on the attendance policy. I think we're going to have to wait until implementation of this to be able to answer some of these questions, because many of these questions may relate to how we have authorized payment and those technicals, and I don't want to misstate how we would actually implement some of the proposals. So I realize that there's a lot of anxiety and challenge for providers to navigate what both the House and the Senate budgets are doing. And a lot of concern about that. Definitely hear that. And so I think that we will need to wait till we see a final budget and probably have a separate webinar to support providers to try and understand what we're going to finally see come out in the conference budget. I don't know if you could speak to this one, Brianne. Green Hill School is experiencing understaffing. Will the two bills related to staffing funding relieve or worsen the situation? And if you can, is this the short term 3 to 6 months and long term 16 to 18 months? Just in terms of how those staffing funding and the funding cuts play out.
So I think what I can say is we're aware that there's a problem, that at our maintenance level step, we're getting a decrease in staffing. I want to clarify that the decrease in staffing does not specifically refer to Green Hill School. It's across all of JR facilities and gets distributed through a plan on where there may be so I'm just trying to say Green Hill School would not necessarily take all of those reductions that occur at maintenance level, but then there were specific ads at policy level for Green Hill School. So I can't specifically answer your question on what the final impact would be, but just to say that DCYF is monitoring this really closely and even sent a letter of concern to fiscal chairs about the funding levels for juvenile rehabilitation. But I can't specifically answer what the final staffing impact would be at Green Hill School based on either proposal at this time.
I do have a question here when I just want to be clear that we're probably not going to be able to answer all the questions that we've received, and many of these, that I'm looking at really do relate to the changes to working connections. And I do think that we will, really need to do some follow-up when we see a final budget. But I do want to try and answer as many questions as we can. So one question is, if we wait until implementation, we as providers do not want to get in trouble or do overpayment, and that's why we are asking for clarification now. That is such an important question, and I really appreciate you asking it. I want to be perfectly clear that what we're looking at right now are proposed budgets, not the final budget. So these are two budgets. They are being proposed, but they are not final. And until we see a final budget, we won't know exactly how the legislature is going to direct the department to write rules. There will be time. I want to be clear because both the House and the Senate approach assume that the department will take time to write rules, to train providers, and to train our staff. And so we will have time to do that. So please don't do anything differently in terms of how you are billing as a provider. And just continue to do what you do until we are able to roll out a final set of instructions and be able to actually train you and how to be compliant with the law. So just want to be very clear about that. And Barb, I see you have your hand up again.
Yeah, I was just going to add, we will definitely plan on doing another webinar after the budget is adopted and after we have more information that we can share. If in fact this is approved in the budget, this change in policy. And I just wanted to remind folks, what Julie mentioned earlier is that this particular change in policy regarding working connections would not go into effect until October 1. So we have several months before any of this goes into effect. So I just want to underscore Julie's caution, there's no need for folks to do anything different right now than what you're already doing, if you're a provider and concerned. So that is all. Thanks.
And Barb, I just want to add, it's October 1 for childcare centers, and that our licensed
Oh.
family homes is a later implementation in both bills of July 1 of the next
Year. Okay, great. So that's even more time for that.
Right.
Okay, thank you.
Okay. And that is all the time we have. So it's 2:00, and I just really want to thank everyone for your time and for our translator on the call. Very much appreciate that. There were some questions about translation services in the chat, and just want to, if you, for our final conference budget webinar, we'll do the end of session webinar. Please reach out and request translation services. We would be more than happy to accommodate that. We just need to be able to set that up in advance. And so all you need to do is to request that for us. So we definitely want to be able to make sure that we're providing the translation services that folks need. So, and again, yeah, thank you to our translators. Thank you to Jessica, and we will stay in touch with you.
So I am madly typing one response. Hopefully if I send it, it'll still go, right? I think. It's just to the childcare center rates question. I think it will.
I'm gonna have to rely on Jessica.
Okay, well, I'm still gonna type it. I'm almost done.
Yeah, I think we should get that addressed. Okay. Thank you all.